name is Jeremiah Schur. I'm the Chief of Emergency Medicine at Rhode Island Hospital and the Lifespan Emergency Departments. And it's my pleasure to give an update on COVID-19 at our hospitals. The first thing I want to say is that we are seeing a gradual rise in cases of COVID. We're not seeing the exponential growth that people are seeing on the news in New York. And our hospitals are completely prepared to care for the patients who are coming to the emergency department and to the hospitals who may be sick. The second thing I wanted to say is that our staff are doing a fabulous job. Our nurses, our technicians, EMS, the physicians are coming to work. They're prepared to care for patients. We want to emphasize the steps that the public is already taking around social distancing and staying home from work. We think these are helping, and we need you to keep doing those. If you can stay home and do the social distancing, the healthcare providers can stay healthy, and we'll be here for you when you are needed. I'll answer a couple other common questions that we're hearing. First is around personal protective equipment. This is a great concern. We currently have the personal protective equipment we need to keep our staff safe. We do have concerns, like other health systems in Rhode Island, about how long that supply will last. We need the federal government and outside manufacturers to deliver additional personal protective equipment, and we are taking actions internally to conserve what we have in accordance with guidelines from the Centers for Disease Control and the World Health Organization. Finally, I want to address why patients may need to come to the emergency department and what to do. We are here and we're able to care for patients who are sick and need hospital care, but we would urge patients to first call their doctor or the Rhode Island Department of Health and only come to the emergency department if you are advised to by your doctor or you're sick enough to need an ambulance.
My name is Mitchell Levy. I'm Chief of Pulmonary Critical Care and Sleep Medicine at Brown University and Medical Director of the Medical Intensive Care Unit at Rhode Island Hospital. My responsibilities have been primarily for critically ill patients and surge planning for critically ill patients in the Lifespan system. There are a couple of things I want to say. Probably most important is I'm very proud of the team that we're working with, and I'm particularly proud of the degree of planning that has been going on for the last 2 to 3 weeks and preparing for the possible surge. The second most important thing I want to say is far and away, over 95% of patients who do get COVID-19 will not need hospitalization, and only 5 to 10% of patients of those patients will need critical care. So for the most part, it's really important that we prepare, but most people with COVID-19, the vast majority, will not need critical care. We have been planning for the surge. We have over 100 ventilators in the Lifespan, over 150 ventilators in the Lifespan system. We have plans to expand to different critical care areas as the need progresses for critically ill patients who need mechanical ventilation and breathing machines who have the COVID-19 virus.
Hi, my name's Deb Coppola. Want me to bring this down? Thanks. Hi, my name's Deb Coppola. I'm the Vice President and Associate Chief Nursing Officer at Rhode Island Hospital, and I'm responsible for the overall care of nursing within the organization. I want to say that nursing is part of this remarkable team, and they're doing an amazing job doing other things beyond their normal roles. They have been manning the 24-hour COVID hotline that we have been providing for our employees. They're educating and supporting those individuals that need help with donning and doffing and utilizing the personal protective equipment that's so important for our patients and for our staff. They're screening visitors. They're going above and beyond, but most importantly, they're on the front lines courageously taking care of these patients that they do every day and making sure that they're providing quality care for these patients that so need us during this difficult time. I also want to say that, as the others have said, we are preparing and have been preparing for weeks for this. And the most difficult part about the leadership in nursing is changing day to day. The information that we get and our processes are changing moment to moment, day to day, and keeping people up to date with that and making sure that they understand the rationales for what they're doing and why we're doing that is so, so important. And I know that people are concerned that perhaps during low census times at this point in time at Rhode Island Hospital that we may be laying off individuals. I can say that there are no plans, and we will have no plans for laying off clinical staff that we so importantly need at the bedside. Thanks.
So our answer is around, we are projecting surges in volume, and we think our emergency departments have the capability to care for critically ill patients who come in. And the hospitals are making additional plans to have additional ventilators, but how many are needed really will depend on what we do as a state in terms of slowing the spread of this. We just discharged some patients from the hospital today who have recovered. And so if we can slow the spread and slow the rate at which patients come in, we will not get to those dire situations. I'll also let Dr. Mitchell-Levy answer about critical care capacity.
So we have been planning for the surge for quite a while. As I mentioned, we have up to 150 ventilators available to us in the lifespan system, and we have surge plans to be able to house those possibly 150 ventilated patients in both Rhode Island Hospital, the Miriam Hospital, and Newport. So it's really difficult to say what the surge is going to wind up being like. We're prepared, as I said, to house up to 150 people. I do think it's possible that we may have succeeded in flattening the curve through some of the aggressive measures at limiting visitation, having everybody inside the hospital wear masks. But there's really no way to say except to watch how things evolve over time.
What's it like to be in there treating for a very sick patient with COVID-19? How's staff morale? What does it look like?
Yeah, I'm really proud of the way our staff is handling this. We have a really fine group of nurses in the intensive care unit. Our respiratory therapists and our providers, our physicians, are stepping up to the plate. They're all involved in the surge planning. And I have to say that walking around the ICU, which I do constantly, I'm really impressed with people's cheer and their willingness to serve and be here at a time of a crisis like this.
How many COVID-19 patients are treated right now?
Really, I'm not at liberty to say the exact numbers of patients being treated in the lifespan system with COVID-19.
So this tent right here is for testing for coronavirus?
That's correct.
So the tent behind us was set up so that when patients come in who are quite ill in ambulance, we can rapidly evaluate them outside of the hospital in order to make sure that we don't expose staff to COVID potentially, because my greatest concern is keeping our staff safe. And so in the tent, we're able to rapidly evaluate if a patient could have COVID, and then they go to one part of the emergency department where staff are expecting those types of patients. And if they don't have risks for COVID, for example, they tripped and they broke their ankle, then they go to the regular parts of the emergency department. The tent went up a couple of days ago, and we have plans that we're evaluating tents at other lifespan hospitals if the surge of patients is great enough that it would make sense to treat some patients outside the emergency department and never have them go inside the hospital at all. That's correct. We have space right now to treat everyone who comes in regularly in the emergency department. So keeping staff safe is definitely our top concern. I don't think it's become a concern. Some people have seen videos out of New York where there are patients lying in hallways and staff members are complaining that they aren't able to get a mask. That is not the case here. We don't have those conditions. We are actively working to make sure that we preserve the supply of PPE that we have. And as has been mentioned, the information about coronavirus is literally changing every day. And so the recommendations for the CDC and from the World Health Organization have changed over the last couple of weeks, and we've updated our protocols to make sure that we're following them and keeping our staff safe, and also preserving their personal protective equipment until we can get more from outside.
Doctor, you mentioned New York. Have you been seeing an increase of patients coming from the state of New York to come here for testing? And if so, do you encourage that? People are concerned, basically, with people coming in Rhode Island from New York City.
So we've read the pandemic surge in patients generally, and we're here to take care of the people who are here who are sick. We don't encourage anyone to drive up to New York from New York. We're not doing testing on many patients because of limitations on our ability to get supplies from outside suppliers. But we will take care of the patients who need hospital care.
I just want to reinforce that we are conserving our PPE and looking at strategies on how we can better use our PPE. People are reusing masks. They're carrying around paper bags where they're using their masks over and over throughout the day, which is typically not what we've done in the past, but it's approved by the CDC at this point in time. And we're looking at sterilizing masks for reuse. And we're starting to do that as of today. So we are very concerned about our PPE. We will remain concerned and vigilant in making sure that we're using it appropriately, and the staff are kept up to date, as I said earlier, on a day-to-day basis with the changes around that.
There haven't been any layoffs between inpatient or outpatient staff?
No, we haven't had any layoffs for clinicians at this point in time. If we do a layoff, I don't believe it's going to be in any patient-facing areas. We're going to need our staff.
So what would be your message to policymakers at the state or federal level about behavior, like stockpiles, and actually all these factors that would get more PPE, but this seems to be done more aggressively to help that?
Absolutely. I mean, we could use more PPE. We do it. We do burn rates on a day-to-day basis. We know how much we have, how many days on hand we have of that, and we deal with this on a day-to-day basis. Are we going to get a shipment today, or when the shipment's going to be in, and how large the shipment is going to be? So we could use a release of PPE, and the other thing we could probably use is more testing kits. We're short on testing kits, and we're prioritizing the patients that get tested, but we certainly would like to be able to test more.
I know many people in the public want to help out with personal protective equipment, and we're really grateful for that. What we would encourage is people can go to lifespan.org, and that's how we're collecting equipment, making sure that it's verified and actually works, and then distributing it to the staff in the areas that actually need it the most.
So to clarify, doctors and nurses, surgeons, all using the same type of masks, and there are enough of those?
So everyone who is directly caring for patients in patient care areas are wearing surgical masks. This type of mask, this is my mask. And when patients are at high risk of COVID or have tested positive for COVID, and we're doing a procedure in their airway that could put particles into the airway, we are using N95 masks or the hooded respirators that are available.
And everybody in the intensive care unit, all providers, respiratory therapists, nurses, and physicians are wearing the exact same PPE, personal protective equipment.
So there's never a scenario where the healthcare provider there in that area, like you were saying, where they're putting particles in the air just wearing a surgical mask, all of them are wearing a N95 mask?
That's correct.
And others. I think it's also important to say that the science and the guidance on this has changed rapidly, and there is a published report out from either Hong Kong or Singapore showing that surgical masks have been highly protective. And as some articles have shown, countries like Hong Kong and Singapore have used strategies with the vast majorities of providers wearing surgical masks like we're doing, and they've been able to keep their healthcare providers safe. I think all of the clinicians think there are probably more cases out there than we've tested because we haven't tested everybody. And we look at other states and we see these increases. And so we are prepared for them. I don't think we can exactly know. We've heard Governor Cuomo say that they think their peak is 2 weeks away. And so it's just very important for the public to know that while we haven't seen that dramatic surge here, it's critically important that everyone follow the guidance to stay at home, do social distancing, follow hand hygiene recommendations, and continue to do that until there's a clear guidance from the government that we don't need to.
And I think the other thing to keep in mind, which accounts for the lower numbers we see in our state, is we suspect that a lot of the large number of cases we see in different areas are because of population density. So that's another reason why we're probably not seeing the same numbers here in Rhode Island. That plus the shelter at home and the staying at home practice that we started early on, I think is also making a difference.
Understanding that you may be a specific number of patients, is there any concern that you're approaching that? Say if you take 150 with 150 ventilators, any concern that you're approaching that, or is there still that?
No, we have a relatively few number of patients in this state with COVID-19 and an even lower number who are critically ill.